Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County. It is March the 23rd, and we're doing another Facebook Live. This is our chance for us to answer your questions, and we'll go ahead and do that. And again, there are a lot of people who put questions in Facebook, questions at douglaspublichealthnetwork.org. We'll get to those first. And then if you put questions in the Facebook Live chat section, we'll get to those. As always, we start at the world level and move down. In the world level, it's a bit worrisome. We're at 123 million cases and 2.7 million deaths. We are clearly in a new spike. So if you look at the curve here, there was an initial spike in March and April, went down a little bit, then up in July. It wasn't really very distinct at that point. It was then low, and then in the fall, it started going up again. That peaked around a little after the new year and then came down in the last few weeks. But clearly in the week over the last 14 days, there's clearly a spike. And it's worrisome because there are cases in multiple places. Europe has multiple countries that are having issues. France, Italy, Sweden, Hungary, Poland, the Ukraine, all are having lots of cases. And the places around them have more than they had before, but not as many as those hotspot areas. South America, which has always been problematic, is now even more problematic with Brazil, Uruguay, Chile, all having lots of cases and lots of deaths. So Brazil had 3,000 deaths today. So really a big worry that Brazil is really heating up. And again, we worry about Brazil especially because there are a lot of variants there. And unfortunately, people from Brazil travel elsewhere and then travel to the U.S. and their variant, which is a tough variant, could easily spread. The Middle East is also hot, started in Israel and has now moved out and has now moved to some of the Gulf states, so a little worried there. In the U.S., with 30 million cases, about 550,000 deaths, our case count is flat overall, although the last 2 days went up a little bit, so that's a worry. We're seeing lots of cases in New York, New Jersey, eastern Idaho, Michigan, and Texas, and we have a lot of people in spring break down in Miami and South Texas. Miami looks just crazy. There's a lot of cases, about 40 cases per 100,000, and that's at a time when all of these kids are coming down there and people are really gathering so much so that they had to have a curfew because people were so gathered together. That really is a playbook for another surge, so I'm very worried about that. In Oregon, it's been quiet except for Southwest Oregon. Coos County and Josephine County are really struggling with the number of cases. Douglas County, we're clearly down. As of this morning when it came in, we only had 2 cases. It was like, oh, this is like the good old days. And we had 7 by noon. We're out of the extreme range and into the high range. So this Friday, when the change actually takes place, we'll move in the high range, which will allow more openings for restaurants, bars, and gyms. Now, that doesn't mean we should let down our guard. We should still be careful, but it'll allow more commerce to continue. We're still seeing outbreaks, and the outbreaks we're seeing now are workplace outbreaks. One person at work, especially if they're not good at using masks, then spreads to 5 or 6 or 10, then spreads to their families and spreads elsewhere. So workplace is really a worry. We have 3 good-sized church outbreaks now, and so churches are a worry. Throughout this whole thing, we've had about 20 different church outbreaks, and many of the church outbreaks have gotten large. Several have been associated with lots of deaths. So church is a worry. Churches can be safe. We have some churches that have had services all along, but they've done distancing and masks. They've not had outbreaks. But the churches that have not done distancing and not done masks, especially churches where they've been singing, there have been clearly some spread. And then birthday parties. I don't know what this disease and birthday parties have against each other, but it must be something, because we have seen so much disease spread at birthday parties, and some have been truly heartbreaking. The birthday party for an 80-year-old, the 80-year-old gets it and dies. So that's not a very good birthday present. So we do worry about those parties, because typically birthday parties bring in 10 or 20 people from 5 or 10 households, so a chance to spread is great. Okay, so let me get to questions if people had more. So Paul says, maybe I'm confused, but I thought I saw in recent news media that Douglas County was going to go to the next group of people eligible for that vaccine, that being group 6, which are people 45 to 65 with underlying conditions and others with some qualifying priority criteria. I see on the OHA website that both Douglas and Lane County had not passed muster to move into that group. I don't get what that means. Now, the OHA did not publish that Douglas was moving into that as of last night because they were late in processing our information, but we did send that information to them. What we've asked is to move to do group 6, which is the people 45 to 65. And the reason we did that is that a number of events that were held around the county last week did not have enough seniors to fill. So remember, we did our big event on the 13th at the fairgrounds. That nearly filled but did not fill. Lower Umpqua Hospital did an event for seniors. It had a lot of people but did not fill. And a number of the pharmacies last week did not fill. At Aviva, when they were giving vaccines to people 65 and above, they used all the vaccines, but they frequently had to reach people less than 65 to do it. And when we asked the big clinics, they thought that they had done most of their people 65 and above. So Douglas County was approved. Now, the one thing that we asked for was that when we vaccinate in frontier areas, so if we go to Tiller or if we go to Toketee and do a thing, we'd really like to just do everyone, rather than saying, okay, we're only going to do people 45 to 65 in Tiller and only have 6 and then have to come back 3 weeks later when they open it up to the next group, and then 3 weeks later when they open it up again. What we'd like to do when we go to the frontier areas is do everyone. So if we're going to go to Tiller, or if we're going to go to Days Creek, or if we're going to go to Toketee, just do everyone there so that we don't have to go there once. We're set to get enough vaccine in the next few days that we'll be able to, in the next few weeks, that we'll be able to do that. So that's what we're getting there. Paul also says, I commented that Douglas County vaccination basis, we may have more folks receiving the first or second dose than indicated by the State of Oregon website. So here's the news. The news is that the state counts vaccines that are in a system called the Oregon Alert System. That is a great vaccine registry system that I'm proud to say I was one of the original people working on that. This was back in the 90s when we recognized that the previous way of counting vaccines was to have those little cards and to have no registry really was problematic in a lot of ways. People would lose those cards and then have to not know about the vaccines or need to get vaccinated again. We also knew that if a person moved from one place to another, it was sometimes hard to get those vaccine records. And the vaccine records, as we were doing more and more vaccines, the vaccine cards were really hard to do. So in the 90s, there was an idea that you could have a vaccine registry. And what the vaccine registry would be a centralized database that would have all the vaccines in it. Well, it took us 10 years to get it going, but once it got going, by the early 2000s, it was pretty darn good. And now Oregon has probably the best immunization alert system in the country. So we, for example, when we look for school vaccinations, we're able to do that quickly, very accurately. It very accurately predicts who needs what vaccines, and it's really been indispensable for this. So what happens is when most practices do their vaccines, their EMR uploads these to the Oregon Alert System, and so if you get a vaccine today, it's there tonight. And then similarly, if you go to the doctor's office and say, which vaccines do I need, you can press a button and it tells you what vaccines you've had and what you need. It's really a great, great, great system. And so Mercy, EMS, pharmacies, all the practices submit their data to Oregon Alert. And I get to see the data once a week, and I pull these great spreadsheets out and look to see how long it's taken people to get data in. Very short. How accurate the data is, incredibly accurate. It's hard to believe that we don't make more fat finger errors. And who's given all the vaccines, and it's really been great. There are 2 large entities in Douglas County that get their vaccines directly from the feds. That's the VA and the Cow Creek Tribe. So the Cow Creek Tribe and the VA do not get their vaccines from the state, they get them from the feds. And since they get them from the feds, their requirement is to enter these into the federal system. So then what happens in the end, when the feds look at this, the Oregon Alert System goes to the feds, but the CDC numbers don't come back to alert. This is really a problem because if I got my I'm a veteran, if I got my vaccines at the VA, it wouldn't show up looking in the state data, it would only show up looking in that data. So the problem is that the numbers for Douglas County we think are off by about 12,000. We talk to the people at the VA in Cow Creek all the time, so we've got a great relationship with them, and they're not unwilling to work with us. They are just required to send their things to the feds. And so they do what the requirement is send to the feds. The problem is the feds haven't sent it back to us. I mean, it's just frickin' data. And I'm not looking for individual, Joe Smith got it on a certain day. What we're looking for is how many people 80 and above got vaccines at the Cow Creek Tribe or at the VA. And they're both willing to work with us, but what we really need is their data that they sent to the feds and have the feds send it back. And so we've worked with the senators' offices. I've worked with other people. I am told that it's going to get fixed in this next week, and I'll believe it when I see it. So, when we look at our numbers, we are a few percentage points below other counties around us. And I truly, when you add in those 12,000 that I know have been given, we're actually a little ahead of the counties around us. But I'd really like to know the data. I mean, this 5,000 and 7,000 numbers that we got from the VA and the Cow Creek Tribe are their kind of estimates of what's going on. We don't need estimates in this state. We have computers. We really should be able to get down to the individual level where we're at, and it's just maddening to me that we're not there. So lots of people are getting vaccinated. Yes. Feeling safer being around friends and family. Yes. CDC has guidelines for people getting together for people that are vaccinated. But what about hugging? People want to hug. Well, I'm not a big hugger, but I know there are people who really are, and people want to hug. I think the recommendation is that if people are fully vaccinated, that regular activities without masking or social distancing are acceptable. So hugging for people who are truly vaccinated, are both vaccinated, are fine. In addition, CDC said normal social activities between fully vaccinated people and low-risk people like kids is also acceptable, which I call the grandparent exception. Now, what do I tell about this? So the story is that the vaccines are great, and we just pulled the data today, and they look like they're really great. So we know among our teachers and we know among our first responders that they all offered vaccine in January so that they could all be vaccinated at this point. And so we pulled our cases over the last month or so, and it was truly shocking. I haven't done the final analysis yet, but almost all of our cases were in unvaccinated people. Well, since at least half of the medical people and probably half of the teachers, probably not quite so many first responders, were vaccinated. If the vaccines didn't work at all, you'd expect to see a similar number in each group. If the vaccines were perfect, all of the disease would be in unvaccinated people. And when I look today, it looks like pretty close, like all of the disease, almost all of the disease was in unvaccinated folks. So it really does look like the vaccines are very effective. And so that if you're fully vaccinated, that is Johnson & Johnson plus 14 days, or 2 doses of Pfizer or 2 doses of Moderna plus 14 days, you're considered to be fully vaccinated. And so the recommendations that the CDC came up with is when both parties are fully vaccinated. So what about if one party is fully vaccinated and the second has only 1 of 2 doses? Well, it's not in the CDC guidelines, so it doesn't say that it's safe, but obviously it's safer than if you had none. And then the third question is one party fully vaccinated, the other party not vaccinated at all. And again, if that other party is a low-risk person, like a child, then that's okay. So there's always going to be some risk. And you'll remember that I don't ever draw a line and say, well, that's safe and that's not. There's some things I say are just much, much safer and much less safe. So if 2 parties are vaccinated, the chance of one having the disease and then spreading it to others is probably less than 1 in 1,000. So that's relatively low risk. If one party is fully vaccinated, the second party with 1 or 2 doses on board, it's going to be about a little more than 1 in 1,000, but not much more. 2 people not vaccinated, both two people not vaccinated at all, both high risk, which is what it would be for before the vaccine was out. Moderately high risk is still not very high, only about 1 in 30. So it's still not like every time you went to a bar or every time you went to a party you would get sick. So when we would see a birthday party and see a bunch of cases, for every birthday party that there were a bunch of cases, there were probably 29 other birthday parties for which there were no cases. Or for every time we saw a workplace outbreak, there were probably 29 or 59 other places that didn't have a workplace outbreak. So it just goes in the risk. So if both parties fully vaccinated, everybody feeling well, risk is pretty low, I would do that. One party vaccinated, the other party not vaccinated in a low risk situation, I would be worried about that. But hugging is clearly part of human nature. I think we are missing some of the human touch, some of the human contact, and that would be great. So Susan says, how long will my vaccine last? Any data on this? We have 6 month data from the early Moderna and Pfizer trials, and it looks like at least 6 months. But we're not so typically what you see is that if vaccines are going to last a certain while, what you'll see that it's maximally effective, and then that effectiveness starts to wither. We're not seeing that yet, so it looks like at least 6 months they're effective, and we'll just have to wait for the further trials on the Pfizer and the Moderna to see how long it's going to last. But so far, it's looking good. So Cheryl says, I love how much contact tracing we're doing. Any idea why other counties aren't doing as much? Yeah, I have some ideas. One of the ideas is that Douglas Public Health Network and Douglas County work together on this, and we, as public health departments focus on different things. So there are some public health departments that really focused on chronic disease. There are some that really focused on reproductive health. There's some that really focused on other kinds of things. And while we did all of those things, we tremendously in Douglas County focused on emergency preparedness and epidemic preparedness. We said, yeah, those other things are important, and I know they're important, but other people can do work on obesity and work on reproductive health. That's what doctors do in their clinics and whatever, but the only people that can deal with emergencies and the only people that can really effectively deal with outbreaks are going to be public health. So the people we hired and the group were really, really of the mindset to do that. So our executive director at DPHN has a long history in emergency preparedness. Brian, who works with us a lot, has a very long history in epidemics, having worked with polio and other kinds of things at the World Health Organization and at CDC. He's a local boy, but that was his background. Our epidemiologist had a background working in Africa with the Peace Corps, so really has it with dealing with disease. So that's where we set up, and that's why when this started, this was, okay, we're ready. We're totally ready for this. Other departments, I think that were focused on other things, had a real hard time shifting their focus to emergency preparedness and epidemic disease. The second is, I think the model we have in Douglas County, where Douglas County has the public health authority and then they contract out to different things, has really made a big difference. We're not-for-profit, so there's a lot of things that a not-for-profit can do that a governmental entity will struggle with. So to give you an example, this Tiger Team thing that we were going to set up, or we've already set up, the state's been talking about this for like 3 months now, about doing something, and they finally maybe get it ready, and we think they'll probably have it ready sometime in the summer. We in the county said we should do this. Within a few days we got the funding, in a few days we could hire the people, and next week we'll start. So that kind of model using not-for-profits in the county really has allowed us to hire who we want when we want to hire them. When we want to set up a contract with the ambulance company to deliver vaccines to homebound people, we can do that in a week. Whereas if you do this through a governmental agency, it takes a lot longer. And so I think our arrangement that we've done is great. And then the last reason is we just hired a bunch of incredibly great people. So these are all local people. These are people, if you saw them in the grocery store or down the street, you'd know who they were. And they were working at other jobs, and we kind of stole them away to do contact tracing. So when we look at the teams here, Vanessa had been doing public health consulting, and we brought her on. Becky had been doing some other kind of consulting. We brought her on. Kim had been working at Aviva, and we kind of stole her. And so we used all these people who were already here very much in the community, and they are community people. So these are local people who, when we have a question of, well, how's this person related to this? We almost always have somebody from that area who says, oh, well, that person's wife was previously married to this person. And so we know the background, and then contact tracing gets a lot easier when we kind of know the background of what's going on. Many places have sort of farmed this out to telephone farms and other places around the country. We've done this all very, very locally. So I think that's why we're doing better on this. So better preparation, lots of support from the county, and a model that allows us to do it. And I think the third thing is we've hired really good people to help us with the contact tracing, and this has been great. Now, some of those are going to now move and do our Tiger team, but then we'll likely be hiring others to go ahead and backfill them for our contact tracing and support services. So Veronica says, doesn't Brazil have COVID shots, so why the surge? Brazil has very few COVID shots that they've given out, and their surge, we think, is mostly because of the P1 variant, which is very prevalent in Brazil. And the P1 variant is probably the most worrisome one. So in the P1 variant, the vaccine doesn't work very well, even if you got it. And even previous infection with the non-variant strains gives you an 80 or 90% protection. And that's kind of what we've seen. So we saw that people who were infected early on, we've seen a couple of them get infected again, but mostly not. But what they're seeing in Brazil is that even people who were infected 6 months ago with the previous strain get the P1. And they get just as sick with the P1 as they did before. And that's why we've had the big surge in Brazil. It's going to be hard because I don't think any of the vaccines work particularly well against the P1. So my concern is this going to continue to percolate, not just in Brazil, but in all of South America. And as it percolates in South America, you may get even newer and more problematic variants. So these variants have a certain number of mutations in them. So the UK variant's got a couple of mutations. South Africa's got a couple different ones. And then the P1 variant in Brazil's got a bunch of them, 17 different mutations. But there's nothing to suggest that you couldn't gather another 5 or 6, which would make the vaccine work even less well. You say, well, why should the vaccine work less well? Well, the way this works is that this vaccine was developed against the original strain, which is the B.1 strain. And the B.1 strain has a very specific structure to it. And then what the antibody to that does is it just attaches directly there. If you change the structure of that thing even enough, the antibodies that you produced from the B1 strain will not attack it and will allow it to continue infecting. That's what we think is happening, and that's why we worry so much. So Patty says, if one gets their vaccine at Cow Creek, will that show up on the state vaccination record? Not yet. So not as of last Friday when I looked. So it doesn't show up yet. And this is because their EMR is primed. They have a nice EMR that I've worked with, actually, and it's primed to actually send the data to the feds. It doesn't do well sending the data to the state, and so they have not yet showed it to the state. So that is a problem. It does show up in the record, but at the CDC record. And what we're asking is for them to come back. Ronnie says, have we had any more Brazil variant positive cases in Douglas County? No, although we only have a few other results yet. So we still have a bunch of variant tests out there. This has been really frustrating because you'll remember that Brazil we sent in January didn't get back until March. Some of the ones we sent in early February we're just starting to get back now from the CDC. Next week, our state is going to be doing the variant analysis with a 1-week turnaround. It's exactly what we need. So what we need is to send it within a week, get a result. Is it a variant? So that we can now track them back. We can almost always track a case back 10 days. It's really, really, really hard to trace a case back 40 days. So how many vaccines have been given in DC, not counting the Cow Creek or the VA? Well, you can find that on the state website, and I can't show you exactly how to get there, but if you go to OHA, and you go to the OHA page, it then has their Tableau databases. And their Tableau databases, there's a bunch of them. The one I'll pick is the Vaccination Trends. And the Vaccination Trends show the number of vaccines given by day. And Oregon is doing a great job. So in Oregon, we have administered 1.54 million doses, which is great. Now, interestingly, it's kind of evenly split. So if you look for people 80 and above, it's 114,000. For people 70, 74, 133,000. 65 to 69, 144,000. And then goes down for the people 60 to 64, but then is high again in people 30 to 60 because those are people working in healthcare and as teachers. So that's the state. You go to the county data, and then so it says view county data, and it looks at the different areas, and it says Douglas County has 112,251 people. There have been 31,662 doses administered in Douglas County as of this morning. And so they look like they're there. They look like they're appropriate. Of those, 962 were J&J, 21,000 Moderna, and 8,800 have been Pfizer. And so that's great. And then we look by the demographic group in Douglas County. It suggests here that we've given 3,795 to people 80 and above, 2,900 to people 75 to 79, 3,818 to people 70 to 74, and 3,819, very close number of those 65 to 69. So about 16,000 to people 65 and above. We think there are about 30,000 people 65 and above. And so that would be a little on the lowish side. But again, Cow Creek has also been vaccinating a lot, and the VA has vaccinated a lot of seniors. So when we were doing the screenings for our March 13th event, there were at least a dozen cars where I said, well, doesn't your husband want to get it? He already got into the VA. And so that does it. The other thing that's striking here is there's a striking female to male predominance in Douglas County, suggesting we're missing some male vaccinations, which again would suggest is the VA. So if you put those numbers in there, the numbers are pretty high. So there's 31,662 which are in the alert system. If there's another 12, and there's probably even more now, 12,000 from the VA, that gives us 43,000. So 43,000 doses puts us very similar to the other counties around us. So it's really easy to look. The OHA website's an easy website to look at. I look at it probably 10 times a day to try and get one piece of data or another. Okay. How many vaccines? Oh, let's see. Okay. I hear J&J is doing 2 vaccines. Is that true? Ronnie asks. Well, I think every one of the companies that's giving this is looking at different ways to get their vaccines. Could you do this as a booster? Would 2 doses be better than 1 dose? For the Moderna and the Pfizer, could 1 dose suffice? So there's all this study going on, and I think it's reasonable that people are doing the study. I think for right now we're going to stick with 1 dose J&J, but I would have no doubt that come this summertime they're going to have boosters for these other things. I don't know about that, but we'll see. If I got my vaccine at the DC event, will it get logged in the state alert system? It has already been logged, and we checked that today, and it was 100%. So it was. Please talk about vaccine efficacy and risk. Is it almost perfect? Well, nothing is perfect. So what are the risks on these vaccines? So the risks are both those things we know and then those things that we don't know. So the things that we clearly do know is that about one person in 100,000 or so has an allergic reaction to, a severe allergic reaction to the Pfizer and Moderna. Some of those people have required emergency care. Some of those people have required hospitalizations. There have been 0 deaths. We know on the J&J vaccine that there are some allergic reactions. We don't think there have any been serious. And again, no deaths. We do know that some people who get the vaccine will die. Now the question is, are they dying from the vaccine or are they dying from something else? They're looking at that very carefully, and there's nothing to suggest that there's any excess deaths from the vaccine. Now, what I would tell you is that the AstraZeneca data in Europe, AstraZeneca not yet approved in the U.S., not yet used in the U.S., there is some concern about a 2 in a million event in the AstraZeneca recipients, which seems a little unusual. That is people having clotting and low platelets at the same time. For example, I saw one of those that you would have expected 2 among the number of people given, and there were 12. And for another thing, you would have expected 1, and there were 5. So there may be some of these adverse things, but let's say even there was a 2 in a million chance or a 2 in a million problem. Is the vaccine still worth it? And again, that's where you have to do the analysis here. And the analysis gets really, really, really hard when you get vaccines. Because if you tell people that there's a 1 in 1,000 chance of dying, which is nearly eliminated by getting this vaccine, but then a 1 in a million chance of dying from the vaccine, most people will not take the vaccine, although clearly, mathematically, it's in your favor to take the vaccine. And that's why vaccine risk and benefit is so hard to do. But the good news with these vaccines is the risk seems incredibly low and the benefit seems really high. So again, when we look at all of these people in Douglas County who've been sick over the last few months who were eligible for vaccine, and almost all of the diseases in the unvaccinated group, it really suggests that these vaccines are strikingly effective and very safe. I mean, the ambulance is there at all of events and they just sit there with nothing to do. And while we've had some people with sore arms and stuff like that, no other long-term side effects. So I think if you had to look at the risk and benefit on this, the benefit is enormous and the risk is very low. So I have 0 issues with recommending this vaccine for everyone. So Ginger says, my second Pfizer vaccine was in mid-February. Do I know if a booster will be needed before winter? We do not know. Again, I wouldn't doubt that there would be a booster, and the booster might have some of the variants in it so that it would also protect against the variants. That's going to take a little while, so I still don't know. So can fully vaccinated people from different regions still get together, or should they mask and distance? Well, if they're fully vaccinated and they're from the U.S. Now, I think if you're talking about people who are coming from an area where a variant is pandemic, it may be different. So if you're coming from South America or South Africa or the UK, it may be different. But let's suggest you're coming from Oklahoma in the US. I think the current recommendation is that is a relatively safe activity. I saw the math on this the other day. They said, let's say there's 2 couples getting together, and let's say the vaccine is 95% effective, which it is. The chance that one of the people will spread it to somebody from the other household is only, it's 0.5, it's 5% times 5%, so it's 0.05 times 0.05, which is 0.0025. So less than 1% chance that in this group you're going to spread it to anybody else in comparison to what your risk was before. So it's 100 times safer than it was before, and 100 times safer you could do it. Now, are there some people who are just absolutely petrified of getting this disease? Yes, if you are, then don't even do that. But I think for the rest of us, I think 100-fold risk reduction is certainly enough not to worry about it. So Chad says, does the vaccine work well against the P1 variant? We really don't know, because remember, the P1 variant is mostly in Brazil. Brazil has not done a lot of vaccination, so we don't know. The laboratory studies suggest that it's not going to work as well. because it has the EEC mutation, and the EEC mutation makes the vaccine work a lot less well. So that's what the worry is, and this is, when I look now, the things look great in the world. For us to have less than 10 cases, for us to be able to open up with a great number of vaccine. There's clearly one future here which is great. The other future, unfortunately, is that the P1 variant starts to spread quickly in a community, and then in that community, all of the vaccinated people are not protected. There starts to be a lot of cases among people who are both unvaccinated and then vaccinated, and then it starts to spread to other areas. That would be kind of a nightmare scenario. Okay, we've got a couple of other interesting things. One is about the Astrozonical vaccine, which we talked about before. So it's been released for use in Europe. The clotting thing is clearly real. Is it related to the vaccine? It's hard to know. And if it is related to the vaccine, is it enough of a problem to stop? And I think their recommendation was not. It's going to come up for CDC review this year. There were some concern about the way AstraZeneca has done all of this. The other trials were really tightly done. They carefully looked at exclusions and inclusions. They were very good about getting people their second dose at the right time. There were no other issues that came up. There were no safety signals. With the AstraZeneca vaccine, there are a couple of problems. One is there were some early safety signals, and safety signals were cases that you wouldn't expect that didn't get totally cleared up in time. The FDA was especially ticked when they heard about these in the media rather than from AstraZeneca. The second is that there was a lot of sloppiness in the design. People were getting their second doses early and late. That was worrisome. And then the third concern was that there was a dosing error. So for the people who got this in Brazil, rather than getting the right dose, they got a low dose. And so it was really hard to know what to make of that. And now the problem is that when they submitted the data to the FDA, they stopped in mid-February rather than getting the most up-to-date data. Now they said it was, so well, that's the day we told you we'd get you data, but there's something fishy when they don't give you all the data. So there's a bunch of just stuff with AstraZeneca, which is a little fishy. And this is why we've got these panels who are going to ask the tough questions like, wait a minute, tell me how you made that dosing error in Brazil. Very long and complicated story, actually. But they made it because they could have used PCR or they could have used weight. They used weight, and it turned out that was wrong, that they got it wrong. And so AstraZeneca, I'm not sure what's going to happen with them. I think they'll get approved, but I think with the other good vaccines out there, they will struggle. The other one is about a late psychological issues in people who have COVID. So these people have COVID, typically have a mild case of COVID, and then a few weeks later start to have very significant psychological problems, including psychosis. Psychosis is where you're really not thinking straight. Paranoia, other kinds of things. And this usually happens a few weeks later, so it's not right with the disease. And it usually does not happen in people with pre-existing psychosis. So these people who've never had a psychotic break before, and it's been more in people in their 30s, 40s, and 50s. So not older seniors and not in kids, but in people 30s, 40s, and 50s, they get it, kind of get better, and then they start to have the psychosis. That's very worrisome. It's a psychosis, a terrible thing to have. Now, most of the people seem to resolve, yet it's a worrisome side effect. The other late side effect is tinnitus, which is this ringing in the ears. And we've probably all had a little ringing in our ears at one point, and it is annoying when you get it. But it can get to the point where it is so annoying that it really drives people mad. And apparently the CEO of Texas Roadhouse, this big chain of restaurants, got COVID. His tinnitus got really, really bad, and he took his own life because he just couldn't live with it anymore. So that's really worrisome. But again, these seem to be rare, but we're learning more about this disease. What a weird disease that some people are asymptomatic and never have symptoms. Other people die, but then other people have a mild case and then later on have the psychosis or or the tinnitus, that some people have clotting problems. It's just all over the place. So Zay says, if one were to get a clotting issue from the vaccine, how long would it take to show up? And again, we don't know. The ones that are in the study, it was within 2 to 8 weeks after the first dose. So they didn't look at, they don't have that much experience, but around 2 to 8 weeks. What's the appropriate time for the first and second dose of the vaccine? So for the J&J vaccine, single dose. For the Moderna, it's 28 days. For the Pfizer, it's 21 days. But, the second dose having to come at exactly the right time is really just a fiction. The companies did that studies because they wanted to get their studies done, and they had to pick a time, and they both realized that was the time. And it's a good time. You can go a few days earlier than that, or up to 42 days after the first dose, and I think that's fine. I think there's enough. Early on, there was a suggestion that maybe we would just go with one dose so that we could vaccinate more people. But there's enough vaccine out there now that my recommendation is you get the second dose 21 to 42 days after the first. So Liz says, what can be done about tinnitus? My husband had COVID and has anything we can do? I don't know. So this is something I would definitely talk with an ear, nose, and throat doctor about, because tinnitus is clearly in your ears, and it can be pretty miserable. I am very sorry to hear that, because there is not great treatment so far that I know for tinnitus, but I'm clearly not an expert in that area, so I definitely have them speak with one of our great ENT doctors here in town to see if there's something we can do. Well, that is bad. So the last thing I want to talk about was these tiger teams. So these tiger teams, again, a group of 6 that we've repurposed. And we've repurposed mostly from our testing clinics. So our testing clinics early on, when we did these right around this time last year, March 13th was our first. We did them because tests were hard to get. There was only a few places to get them. They had to be done with a deep nasopharyngeal swab. And at that time, there was really scarce PPE. And so when we did these at the fairgrounds using our moon suits, this was all reusable PPE, so we did not waste any PPE to do the tests. In addition, a lot of the clinics were really nervous about doing the test, so we started off doing them. And we did as many as 100 tests a week at one point. We were going to Reedsport on Saturdays. We were doing twice a week here, and we were really the only place to get vaccines. Well, the good news now is there's lots of get tests. The good news now is there's lots of places to get tests, including much more comfortable interior nasal swabs. So at least 30 places in town have the Binax Now test, where they can do this anterior nasal swab and get you a very accurate result in 15 minutes. So what we've seen over time is that there's more and better places to get the vaccine. The number of people in our clinic have dropped, and a few months ago, we went to just once a week on Fridays, and now we're down to just 1 or 2 at these clinics, and these are mostly pre-op patients. So starting in the next couple of weeks, we're going to stop our Friday testing clinic and devote our time and effort towards vaccinations. And so in the next couple of weeks, we're going to be stopping that, and we'll announce when we did how many done. We've done well over 100 clinics, and we tested well over 2,000 people, and we'll get you those numbers the next time. But our testing clinics at the fairgrounds are going to end because we're not doing very many, and to have 6 people spend a whole morning to get 2 samples is not as good use of our time as going the tiger teams. And what are the tiger teams? So the tiger team is this group of individuals. We're going to have a vaccinator, we're going to have a couple of medical assistants, and others, and their job is going to be going to places that are going to be tough to reach otherwise. Right in our group right now, we have our shelters, we have Tiller, Tokedy, some of our seasonal farm workers, some of our food processing groups, and some areas that have low-income housing. So these are places where people can, this tiger team is going to go out. Typically, they're going to do between 100 and 200 vaccines a day, and then the next day go somewhere else. We're also going to use fire stations, fire stations actually make a really good place to do these. So we're gonna be doing those over the next few weeks. And so some of those people are the people who were previously doing the testing. Okay, so Mary said, I thought I saw something about the vaccine helping with long-term COVID symptoms. Is that possible? Well, the story is with COVID, I'll never say anything is impossible because everything is odd with this disease. And yeah, I saw that there are some anecdotal reports of people who have this long hauler syndrome, chest pains, cough, extreme fatigue, brain fog, that they got the vaccine, as would be appropriate because they're more than 90 days out from their diagnosis, and they've reported a marked improvement in their symptoms. Don't know how or why that would happen, but it really is a good thing. There are some theories of how that might work, but it is a good thing. The good news is that the worry was that if you were a long hauler and got the vaccine, could your symptoms get worse? And that was a concern early on, but it definitely does not seem that that is the case. Okay, so when are pregnant people eligible? Today. And where can they get a vaccine? From their providers. So it turns out that most of the places that do OB in town, I'm not sure I would say all, but most of the places, I think all of the places in town that do OB, Evergreen, Excellence in Women Healthcare, and Aviva, who are doing that, they all have vaccine. And so they can get a vaccine where they get their pregnancy care. And that's a good thing. We are recommending it for pregnant women. Now over 30,000 pregnant women have gotten the vaccine with no adverse effects. We know that pregnant people, when they get COVID, can get really pretty sick. And there are some really heart-wrenching stories of women in the third trimester getting really bad COVID, getting put on a ventilator, in a coma, finally delivering the baby while they're still in the coma. And then when they finally recover, there's a baby. And so the stories of pregnant women getting this are really serious enough that the recommendations from many groups is that pregnant women get this disease. Now, there was a little bit of a kerfuffle early on. And the reason is that the studies did not include any pregnant women. So the initial studies did not include any pregnant women because it was still a trial, right? So when it's a trial, it's a little difficult to enroll pregnant women, so they didn't. But with this subsequent experience with 30,000 pregnant women who've gotten the vaccine, I think we can be very comfortable in recommending it for pregnant women. Okay, well, we're coming to the end of our time here. Remember, on Friday, we are given a day off to our camera people, and so we're actually going to tape this show on Thursday, but we're not going to take questions on Thursday. So if you do have questions, this is really, really, truly the time to do Facebook questions at douglaspublichealthnetwork.org, because it's kind of a special day. I think all questions will be considered. Like, what's the best part of this pandemic, or the worst part of this pandemic, or whatever you want. We'll go ahead and get those questions. And we'll do those questions on Thursday. We'll post it on Friday at 4 o'clock. But if you want to get questions in, please get them in before Thursday at 3, and then we'll answer as many questions as we get. Otherwise, I think things are going well. I think we have a lot to be proud about as a community and as a country. This has been a tough time, and I think people have stuck together pretty darn well. And I think I'm clearly seeing the end here. Still think there are some dark clouds out there. I still think we could have the emergence of variants either from South America come into our country that'll make it difficult, or especially what I worry about is variants in Africa, because again, Africa's had very little disease, and there's no reason to think that they couldn't have just a tremendous explosion of the disease where more variants would come to the U.S., which would make the vaccine work less well. But nonetheless, those are the dark clouds. I think generally the forecast above is pretty great. I would recommend that everybody get a vaccine. We're going to have our next big event on April the 3rd. We're going to be giving second doses of Pfizer to people who got their first dose on March the 13th. But then in addition, we're going to be giving a vaccine, whatever we get by then, to a bunch of people on April the 3rd. In addition, the Tiger team is likely to be starting on April the 5th, starting to vaccinate in those outside areas. Still, we have 41 different clinics giving vaccine, almost all of the big pharmacies. Let me see if I can remember them all. So 3 by Marts, Sutherland Drug, Costco, Albertsons, Safeway, Walgreens, both Walgreens, Walmart, Fred Meyer's, and Gordon Drugs. So pretty much all of the people on this side of the county, and Reedsport Pharmacy is going to be getting vaccines starting in the next few weeks. So really a great smattering of places to get vaccine. And again, almost all of the big clinics have it. The fire stations, Douglas County Fire District 2, Oklahoma Valley Ambulance, and Glendale Ambulance all have vaccine. So there's a lot of vaccine out there. And so we're recommending everybody who's now eligible, and that's people 45 to 64, wildland firefighters, pregnant women, people living in congregate housing, people with food processors, all get that, all get the vaccine as soon as they can. Our hope would be we can expand it to all adults by May 1st, and then the hope would be by Memorial Day we have enough people vaccinated that we can get into the risk range where gatherings and whatever are allowed. Because wouldn't it be a great summer to have music on the half shell? Wouldn't it be a great summer to have the Pepsi float, to have the fairgrounds? That's really what we're looking for. So again, I think we're done with questions. Dr. Bob Dannenhoffer, the Public Health Officer. Be safe and be kind. I'm so glad that people in Douglas County have been so great. Thanks.